There is style all around you. In everything you do, we're in step with you.
So, but with this sort of heat, we're seeing less and less clothing, and we might be seeing more and more cellulite. Or is it cellulite? Dr. Janet Turkle's here to talk about a non-invasive way, a non-surgical way to take care of that. Good morning. Good to see you.
Good morning. Nice to see you. Yes.
First of all, is it cellulite or cellulite, or does it matter? It's equally...
Tomato, tomato.
Okay, exactly. Okay. We know it when we see it.
Yes, we do.
But what exactly is it that we're seeing?
Well, it is a little pocketing of fat right under the skin.
Mm-hmm.
And the thing that's really neat about the technology that we're talking about today called Cellulaze is I think they figured it out. There's three things that kind of tend to make cellulite, and one of them are the little septa or little fibrous bands that divide the little pockets of fat. Mm-hmm. Then you've got the little pockets of fat, and then you've got thin skin.
Okay.
And what they're showing here is kind of an example of cellulite, which has estimated to probably involve about 80% of women somewhere between the 18 and 54 age range.
Okay.
It's sometimes very minor.
Is it a result of inactivity?
No.
Or I mean, what I mean,
it is.
I know there are women that beat themselves up about it. I'm guessing it's not always the case where it's their fault.
It's genetic, but mainly, as I said before, thin skin, the little septations that divide the fat, and then the little bit of fat that bulges. And you can see this on people that are in excellent physical condition. Okay. And it's not something that diet and exercise are going to take care of. This is kind of a schematic of how the laser addresses that by disrupting the fibers.
Okay.
And then you can heat the dermis to kind of thicken the skin a little bit, and they do show a 25% increase in the thickness of skin after the treatment.
That's significant.
And also you can melt some of the little bit of fat that's causing the bulges.
Okay.
And you know why guys don't get cellulite?
Why?
Because
let's let the viewers hate on Trace. Why don't I get cellulite?
Why don't you get cellulite? Well, look at the little fibers going up and down, kind of perpendicular to the skin.
Yeah.
Guys tend to come at angles where their fibers don't go directly into the skin, and therefore you don't get that rippled, cottage cheese, orange peel appearance.
Good to be a dude in this particular instance.
And generally it is on this particular issue.
Don't hate. I didn't know.
Nope, don't be a hater.
I had no idea. So for the older procedures for this prior to the Cellulaze, what were those?
Well, there's lots of things I would call treatments but not cures.
Okay.
They used to, and still do, lots of different creams and potions that maybe cause the skin to look a little more puffed up for a while. Very temporary. There's a suction roller device that causes temporary improvement, but when you quit that, you go back.
Okay.
These results, I believe the first couple that they're showing are 6 months out, and then I think they actually have some patients that have been in some of the original studies that are almost 3 years out, and the results are still holding.
Okay.
It's a single procedure done in an office under local anesthetic. Small incisions made where this little catheter is inserted right under the skin.
Okay.
And it's got a laser. And you point the laser at different directions to affect the disrupting of the fibers or melting of the fat or tightening of the skin, depending on what you need to do.
So I misspoke a little earlier when I said non-invasive, but minorly. I mean, we're just
minimally invasive is probably the best way to put it. It's an office procedure. It takes, depending on how much area we're treating, between 1 to 2 hours. People are out and about the next day. Working. You're going to have a little bit of drainage for about a day, and then it stops.
And results possibly vary with some?
Actually, the results so far are looking very good. It's a brand new technology introduced by the FDA the very 1st of February. So really nobody around here is going to give you 6-month results because we don't have them yet.
Because they haven't yet. It hasn't been 6 months.
The machine's brand new. But in the beta test sites around the country, people up to 3 years are really doing very well. And it seems to be a one-shot treatment for that area.
For that area, like you said, up to years later. Wow. Now, as far as results, it's not immediate. I mean, you don't. People need to have realistic expectations to walk in and out of your office, right?
Yeah, well, several things are happening. You've disrupted the fibers, so you may see a little dent look better pretty quickly, but it takes time for that body to respond to build that collagen and thicken that skin. And so results at 3 months are nice, but results at 6 months and a year are much better. And it's because of that collagen building and that continued improvement we see.
That's awesome. We're going to put the link, of course, to Dr. Turkle and Associates on our website, indystyle.tv. Pleasure to see you. It's been a while.
Nice
been too long.
to see you.
All that information. And if you missed some of it, it'll be on indystyle.tv later this afternoon. Well, a bowling legend.